Okay, so we are talking about spirituality, mental health, and psychiatry interdependence. Okay, psychology interdependence. These patients' mental health, spirituality, psychology, mental health interdependence is extremely important. You cannot ignore spirituality in terms of psychology. I call it psychospiritual medicine. I defined this in 1996, 1997. It is extremely important. Okay, you cannot ignore it. So as a mental health practitioner, a lot of times, you know, as a physician, we are mental health practitioners, beside the fact that I've always been studying mental health since I remember. Okay, so the point of it is that you will be surprised how many patients who are suffering from depression or any kind of mental health condition, in fact the root of their condition is in spirituality. Why? Because a lot of people, since the day they're born, the root of their existence is in spirituality and spiritual upbringing. Okay, so as these, especially with the and reward guilt and reward system that we have in spirituality. If you do this, you go to hell. If you do this, you go to heaven. If you do this, you get punished by God. If you do this, you get rewarded by God. So if you do this, you're a good person. If you do this, you're a bad person. So imagine a child, at a very young age, is learning these things, and now, as they get older, oh, I did this, I'm a bad person. Oh, I did this, I'm a good person. Well, of course, they're going to become depressed if they did something horrible, right? Because, they start blaming themselves, some self-blame, self-talk. Oh, I'm a bad person. How could I have done this? Oh, blah, 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 blah. So self-beating, right? Subconsciously. Sometimes they're not even aware of it. So like they're all beating themselves up subconsciously. They're not aware of it. Now they're depressed, blah, blah, blah. And now, you just give them Prozac. How the heck are you going to treat this person with Prozac? Mentally, the person is beating themselves up like 25 hours, 24 hours a day. You're trying to treat them with 20 milligrams of Prozac? How? How do you expect that to go away? It's not going to go away. Person can't sleep. You just go, okay, take this and maybe you can go to sleep. No, you can't go to sleep. Patient is anxious because of it. Oh, because of all these mental, anguish that they have. Okay, maybe. Oh, why is this person not able to, relax? Well, because. Okay, so there's so much in-depth spiritual interaction with mental health. But if you don't understand that interaction and in-depth